I can start in no better place than genomics. Genomics is an advancement of unprecedented scale. Some will say it is the single biggest medical advance since the discovery of antibiotics. The ultimate personalization of medicine. Probability, prevention, and treatment of diseases on a genetic level. One thing that we've already discovered is that 1 in 10 of you in this room, your father isn't who you think it is. I told a group of MPs in Parliament that recently, and one of them suggested at the end that I was the first person to turn up at the Palace of Westminster and to get away with calling 10% of MPs bastards. But genomics means that we will also have to start explaining probability to the population. A 58% chance of getting a certain cancer is a 42% chance of not getting that type of cancer. How do you have that conversation with the patient, knowing that the information they interpret will impact on how they choose to live the rest of their lives? Those conversations are happening day in, day out at the moment, but they're going to become much more common as whole genome sequencing is expanded on a much greater scale. So for us, genomics is an enormous re-education and training challenge for the whole of the clinical and non-clinical workforce. It fundamentally changes the nature of care and treatment. Of course, Dr. Google has already changed the relationship between patient and clinician. I'm reminded recently of a GP telling me that he was faced in a 10-minute appointment with a patient with a long-term condition who came in and said to him, "Doctor, I would like to discuss the article about my condition in last week's New England Journal of Medicine." The majority of patients are already checking symptoms or treatments online, making them more questioning, more challenging, even when the information that they've gleaned from incredible symptoms your doctor doesn't want you to know about.com turns out to be a load of rubbish. HEE is already training for genomics. We're trying to produce the workforce as, not after, the demand for the workforce occurs. So we have over 550 people studying on master's programs in genomic medicine as we speak. As a country, through the fantastic work of Genomics England and NHS England, we are committed to decoding the genomes of 100,000 people and cancers. We are leading the world. Interestingly, HEE gets more requests for information about our genomics education program from around the world than any other aspect of work that we undertake. So as a country, the NHS is leading, but there is so much more we can do.